You're a veterinarian. Your days are defined by 12-hour shifts, rabies shots, and telling elderly clients their cats need to lose weight. But the clinic is failing. Rent is late, and a tuition bill for your daughter's first semester sits on the kitchen counter with a red past due stamp in the corner. Long after closing, a fist slams against the glass. A soaked, desperate man kicks open the door, dragging a bleeding body inside. The towel pressed against the injury is soaked through, dripping red onto your clean tile. You point to the hospital 4 blocks away, but the man pulls a pistol and taps it against the door. You're forced to improvise. You reach for horse tranquilizers, a dose strong enough to drop a 1,000-pound animal, and pray you don't stop a human heart. You stitch the damage with the same heavy blue nylon you use on Great Danes. You aren't acting out of greed or a hidden desire for a double life. You are operating because a gunman told you to fix his friend or join him. At this moment, the moral line is crossed purely for survival. After you tie the final knot, the gunman drops an envelope on the patient's chest and carries him out the back door. Inside is $5,000 in cash. You mop the blood off the floor and hide the money in the back of a filing cabinet, behind tax returns nobody ever looks at. Part of you wants to call the police, but you look at the tuition bill again. Reporting the crime means losing the money, and reporting the gunman means hoping he doesn't remember your face. On this timeline, your brain tries to isolate this single event. By framing the trauma as a one-time anomaly that exists outside your normal behavior, you convince yourself that your life hasn't actually changed. But an envelope of cash is a signal. In a world where people avoid hospitals to avoid questions, a veterinarian who works late and stays quiet is a valuable resource. That one night didn't end when the gunman left. It just signaled that you were available. 3 nights later, the phone rings at 2 a.m. It's an unknown number. A voice mentions they heard you do good work and offers double the pay for another situation. You give them the address. Tuesdays and Thursdays become your new routine. You keep the back clinic door unlocked and wait in the dark. You don't ask for names, and they don't offer them. This shows the improvised mechanics of your new practice. A shattered human kneecap is set with a Bernese mountain dog splint. Skin burns are treated with chicken antibiotics. These methods leave jagged scars, bypassing the hospital reporting system entirely. You're trading precision for anonymity. The clinic is now a dual operation. By day, you treat house pets. By night, you run a high-stakes trauma center. The filing cabinet is stuffed with envelopes, and you've started a second hiding spot behind the water heater. To keep working, your mind creates a specific narrative. You focus on the construction worker who fell off a ladder without insurance, or the mother who can't miss work. You use these patients to justify the dangerous men you treat in between. The money allows you to upgrade your equipment and pay your debts. For the first time in years, you feel capable and needed. You tell yourself that you are in charge of this shadow practice. That security vanishes on a Thursday night. As you walk to your car, a black van pulls into the lot. 2 men step out, zip-tie your hands, and pull a bag over your head. Providing an illicit service on your own terms never provided immunity. The system you joined simply waited until it had a use for you that couldn't be handled at your clinic. When the bag is removed, you're in a pristine, high-tech operating room hidden underground. The equipment here is more advanced than anything you've ever owned. On the table is the man who owns the ports and the police. He has massive internal bleeding. This isn't a surface wound you can close with fishing wire. It's a complex surgical emergency. You work for 3 hours. Your hands are steadier than they have ever been, not out of courage, but because you have spent months habituating to the pressure of the underground. You finish the surgery and strip off your gloves. You ask for a ride home, expecting to return to your life now that the job is done. You demonstrated that you can stay calm and ask no questions under extreme pressure. In this world, that makes you too valuable to be a freelancer. The crime board wakes up. When you tell him your daughter needs you, he shakes his head. He tells you your daughter will be taken care of, the best schools, a nice home, and she won't even notice you're gone. He presses a button, and the glass walls of the room turn white, sealing you inside. The door is deadlocked. There is a bed in the corner and a stack of medical textbooks. The syndicate has replaced your financial motive with total captivity. You spent your life saving animals. Now you are the one behind the glass, maintained by a master who will never let you leave.